Now we'll go to the further complications or the long-term problems caused by PCOD. The first one is infertility. Now, infertility is a major cause of concern because if PCOD not treated at the correct time can cause infertility in the female later in her married life. It is seen that 20% of infertility cases are caused or attributed to PCOD. Secondly, even if the female does get pregnant, what can happen is that there can be further complications in her pregnancy. There can be gestational diabetes, that is diabetes during pregnancy, which can cause again complications in the baby. You can have a big baby, or it can also cause pregnancy-induced hypertension, that is the blood pressure of the mother just shoots up during pregnancy. Another sad complication of PCOD is that there could be miscarriages and premature births. Also, there can be non-alcoholic steatohepatitis. Now, steatohepatitis is nothing but fatty liver. Fatty liver is a condition we see mainly in alcoholics where over time, after consuming a considerable amount of alcohol for a chronic amount of time, there is inflammation in the liver. Now, the same inflammation is also seen in PCOD, but even without the consumption of alcohol. It can cause a lot of metabolic syndromes or problems like high blood pressure, increase in the blood sugar levels, and imbalances in the cholesterol levels. The next complication is sleep apnea. That is, when the female is sleeping, there can be obstruction in her breathing, hence causing a lot of disturbance in the sleep and reduce oxygen levels to the brain. Also in the mental sphere, there can be a lot of depression, anxiety and eating disorders. Coming to the reproductive area, there can be a lot of abnormal uterine bleeding, and in worst to worst case scenarios, there can be cancer of the endometrium, that is the lining of the uterus. Okay, now that we know about PCOD and what are the causes, symptoms and complications, let's go a step further and see how do we diagnose this condition in our body. Okay, so when exactly we say it is PCOD? Now, to call it PCOD, the female should be fulfilling 2 of the 3 criteria. The first criteria being she should have polycystic ovaries. Now, as I explained to you earlier, a polycystic ovary is nothing but an ovary that is filled with multiple sac-like cysts in it, and this cyst should be more than 12 in number. Okay, the presence of this cyst can be seen in an ultrasound, that is a pelvic USG is done. Okay, this is criteria number 1. In the second criterion, there should be anovulation. That means the female will not have regular periods. And the third criterion is that there will be hyperandrogenism. Now, hyperandrogenism is nothing but hyper means increase and androgenism comes from the word androgen. So basically, there will be increase in the androgen levels of the body. As I've told you earlier, increased androgen levels in the body will cause the band-like formation around the neck. There will be hirsutism, that is hair-like features on the face, and also it causes insulin resistance. So these are the 3 criteria of PCOD, and to confirm a diagnosis of PCOD, 2 of these 3 criteria need to be fulfilled. Okay, with this we complete the part 1 of this video. Stay tuned for the second session in which I will be covering about the management of PCOD.